Hi guys, we are from Group 11. Today we'd like to present to you our title about genetic factors that influence hyperlipidemia, hypertension and other cardiovascular diseases and what are the effects. Hyperlipidemia. It is actually an elevation of fasting total cholesterol concentration which may or may not be associated with elevated triglyceride concentration. However, as the lipids are not soluble in plasma, they are instead transported in particles known as lipoproteins. Therefore, there are a few classifications of hyperlipidemia are also based on abnormalities of lipoproteins such as chylomicrons, VLDL, LDL, and HDL. You guys know, right? The good cholesterol is the HDL and the bad cholesterol is the LDL. The genetic factors is actually there are some mutation ongoing to the gene, and is specifically termed as familial hypercholesterolemia, which is an inherited condition characterized by higher than normal levels of LDL blood cholesterol. And as you can see, there are a few factors that may contribute to this type of hypercholesterolemia. The effects is, as the cholesterol is delivered via the bloodstream, the tiny particles of the LDL cholesterol attach to the receptor sites on the targeted cells and are then absorbed. A gene on chromosome 19 called LDL receptor gene controls the production of these receptors. As there are a few mutations ongoing on the LDL receptor gene, it changes the way the receptors develop either in number or structure. It means that the LDL cholesterol is not well absorbed into the cells and remains circulating in the blood. High blood cholesterol is a risk factor in coronary artery disease. As it sticks to the artery walls, it produces fatty plaques and narrows the diameter of the arteries. And less commonly, the familial hypercholesterolemia is caused by a mutation on other genes such as APOB or PCSK9.
Hi, I'm going to talk about hypertension. Hypertension is a complex trait that is influenced by both heritable and many environmental factors. Blood pressure has a substantial heritable component which is about 30 to 50% in humans. The genes encoding components of the renin-angiotensin system has been analyzed as candidate genes for inherited forms of hypertension in humans. And the among candidate genes for hypertension is angiotensinogen, which is a member of the serpingine superfamily. As you can see in this pathway, angiotensinogen is the responsible substrate for the causing of the hypertension. The angiotensinogen is expressed in multiple tissues like the liver, adipose tissue, heart, vessel wall, brain, and kidney. And the only known function of angiotensinogen is as substrate to renin, where the renin cleaves the angiotensinogen and so on. And the studies have shown a positive correlation of plasma angiotensinogen levels with blood pressure, where decreased blood pressure with administration of anti-angiotensinogen antibodies and increased blood pressure with injection of angiotensinogen. Mutations in angiotensinogen gene that increases the circulating plasma levels of angiotensinogen could directly increase blood pressure. For example, the M235T variant of the human angiotensinogen gene has been shown to be linked to hypertension and associated with a modestly elevated plasma angiotensinogen concentration in humans. The patients carrying the variant allele were demonstrated to have increased levels of AGT mRNA.
Coronary artery disease is influenced by lipid metabolism, blood pressure regulation, homocysteine metabolism, platelet function, and thrombosis. Lipid metabolism and blood pressure regulation are explained previously, so we will focus on the other three factors. Homocysteine metabolism is influenced by the methylene tetrahydrofolate reductase and cystathionine beta synthase. Deficiency of cystathionine beta synthase, which is an enzyme necessary for the conversion of homocysteine to cysteine, causes an increase of homocysteine. Platelet function is influenced by glycoprotein 1A2A receptors and glycoprotein 2B3A receptors by mediate the platelet adhesion to subendothelial collagen causes formation of primary platelet plaque during acute coronary syndromes. Thrombosis is influenced by protein S, protein C, factor V Leiden, and factors 2 G202108. Normally, after factor V has done its job, two other proteins which are protein C and S will break factor V down and clear it from the platelet to prevent too much clotting. Genetic deficiency in protein C or S causes the blood unable to clear factor V properly, which increases the risk of formation of unnecessary blood clot. The factor V latent mutation makes the factor V coagulation resistant to downregulation by activated protein C. It is the most common genetic risk factor for thrombosis. Gene mutation of factor II G202108 causes overproduction of prothrombin, which causes thrombosis. That's all from us. Thank you so much for watching.